we'll start the class because we have a 1 hour and we want to cover a lot of material. Just before I start, I want to hear from the students. Are you with us and are you hearing me?
Yes, doctor.
Thank you. Okay. So today we will learn about epidemiology. What is epidemiology? You are here to become a physician. Okay? And what is the link between the medicine and the epidemiology? Actually, they are very closely linked. You will find that the epidemiology is called the mother of medicine. No epidemiology, no medicine. And you will know why, because it deals with the disease. Open up your medicine book for any diseases, it starts with epidemiology. So today we will, I want to give you a touch about this vast field. So after this lecture, you will be able to define the epidemiology. We will know the basic terminology and the concepts of epidemiology. We will identify the types of data sources. We will know the basic methods of data collection and interpretation. We will describe a health problem by time, place, and person. And we will learn about, identify key component of and will identify the key components of an outbreak investigation. Okay? So please, if the students are coming late, please don't make noise, just sit. So we'll have to cover a lot of material. And I will try to make it as easy as possible. Assalamu alaikum. No idea. Sorry, my wife is locked out. Okay. Let me see. Yes. See whether do you know how to drive? Huh? Yes. Do you know my house? Approximately. Okay. Go and open the door. Okay. Okay. It's in the basement near to the business school. Okay. And take the
No, no, no.
Take it. And my code is 107. Sorry. The same thing, second time it happened. My wife is supposed to pick up the kids and she's locked out in the house. Okay. Anyway, lecture must go on. We'll have to define epidemiology and we'll describe the terminology and the concept of epidemiology. We'll identify the data sources and all of these things. So, first you know what is the difference between public health and medicine. Medicine deals with one patient, one at a time. Public health always deals with the
Group.
The population. Otherwise, they're both dealing with the disease. So what the public health does, first is find the problem. And how does it find the problem? In every country, public health officials always running different surveillance. Okay? Because of the surveillance, they identify the problem. For example, corona epidemic, when it started, they identified the problem. And then they try to identify the risk factor. And once they identify the risk factor, then they develop intervention. solve the problem. And then they figure out a way, not only developing the intervention, but you have to find out how to give it to the people, meaning the implementation. So epidemiology, the public health approach, start with finding the problem to all the way to the solution. So problem and its response is the public health approach. Any disease, infectious disease or chronic disease, it happens the same. The approach is the same. Now, public health is a vast science, okay? And it has some core topic area. One is the epidemiology. Today we'll learn about it. But other than that, there are laboratory sciences under the public health. There are surveillance. As I said, that in every country, the public health department survey the population for new diseases or an outbreak. We'll learn about it. Last 20 years, informatics, particularly the data informatics, has become very big with the big data. Okay? And the last one is in every country, in public health, run different type of intervention program. For example, vitamin A capsule, or the vitamin, or the supplement, or the smoking cessation program, okay, to reduce the burden of the disease. Now, they also have to assess whether those programs are working. So these are the core public health sciences. But today we will focus on the epidemiology. Epidemiology is 2D, distribution and determinants of any disease. Okay? Now, if you look at why do you need epidemiology? I have given you some example to make it easier. In case of infectious disease epidemiology, for example, COVID or influenza or the flu outbreak, public health official have to discover the agent, host and environment. In COVID-19, what is the agent? The SARS virus, isn't it? And who is the host?
Human.
And the environment is?
World.
Yeah, the way where we live and work, everything is environment around us. What if it is a chronic disease, for example, cancer? Then what epidemiology does? It determines the causes of the illness, what causes a cancer, and disability and death. Sometimes epidemiology identifies the high-risk group. For example, sexually transmitted diseases. Okay, one of the high-risk group of the sexually transmitted diseases is IV drug user, those who take drug intravenously. Not because they are highly sexually active, but because they share needles, they also pass the disease. Okay, so in STD, certain professions, say truck drivers, they are high-risk group. IV drug users, they are high-risk group, and epidemiology identify that group. Unfortunately, in the lecture, there is very little time to interact at the end. Hold your question. And then we talked about that it also assesses the different type of program. For example, in Saudi Arabia, what percentage of the people smoke? 20% in many countries. Now, if you are a government official, Ministry of Health, your task is to reduce the smoking prevalence, and you run smoking prevention program, different kind of program, from the policy to putting taxes on the cigarette, maybe not allowing cigarette to be sold inside the city. Different type of programs are going on, you already know. And epidemiology assess which one work and which one does not work. So these are the uses of epidemiology. A little bit of the same thing, like how do we solve health problem when it the corona came, COVID-19 came, how it was solved. In the first step, we survey, the population is under surveillance, and we determine the disease in terms of time, place, and person. Remember these things, time, place, and person. Second is we collect data, and then we assess. The third thing is that we test our hypothesis, if we have an hypothesis in mind that this causes this, and then once our hypothesis is proven, we take action. So these are the solving the health problems. Any health problems goes through this 4 step. Now, these are some of the key terms that you will have to remember. One is the epidemic, endemic, and pandemic. This is also paid question in your block exam and also into your progress test. And often you don't remember. So I haven't given you the whole definition, just the key word so that you remember. Epidemic. Epidemic is for any given disease if the observed is greater than expected. What are you expecting? If the disease occurrence is higher than that, you can call it as a epidemic, like influenza epidemic. Okay?
So better results?
Say it again?
I mean better results? We get better results than expected?
No. Expected means like in the population, disease is always present at a certain level. That is expected. That say 5% of the people in the population at any given time have influenza. Anytime it goes to 20%, meaning the observed is greater than the baseline expected, and you can call it a epidemic. When is an endemic? Endemic is when a disease constantly present in a population throughout the year, always present. You will find in different areas of the world malaria endemic. You go there, malaria is present at a low level at all time of the year. So endemic is constant present. So then what is pandemic? Pandemic is just epidemic on a larger scale. If it is in one country, then it's an epidemic. If it is one region, still an epidemic. If it crosses 2 or 3 regions, 2 or 3 continents,
Pandemic.
it becomes pandemic. Okay? So these are the things that you must remember, because always question comes from that. The fourth is the cluster. Okay? What is a cluster? Cluster is a group of cases. Anytime there is a group of cases, we call it in epidemiological term cluster of diseases. Okay? Say a cluster of diarrhea in the male dormitory. Say 10 or 12 male students suffered from stomach upset, diarrhea through a bacteria or a virus. And if I can identify 10 or 12 people, we will call them clusters of diarrhea patient. Rate, I will not repeat, because in the last class we learned about the rate. Why rate is important? Rate is important because with the rate you compare between the population. With the count you cannot compare, because count does not take into source population into account. Forgot about the definition of the rate. Rate is the population at risk. It always takes care into the population at risk. It does not only talk about the number of cases, but also about the population of risk. Okay? Why? If you don't understand, let me give you an example and you will understand. Say I am 50 kg and you are 60 kg. I gained 5 pounds and you gained 6 pounds. Now can you compare between 5 pounds and 6 pounds? You can say that the guy with the 60 kg, he gained more weight. But that doesn't take into account what is our original weight. I was 50 kg and you are 60 kg. You can calculate percentage. And if you calculate percentage, you may find that I have, percentage wise, I have gained more weight than you. So rate is like that. Rate taken to the source population.
Comparing between populations.
Right. We'll give you a scenario. In an unexplained pneumonia, 1976. In the US, in one town called Philadelphia, there was this, America likes to fight. They have a lot of soldiers, and when the soldiers retire, they call veterans, or they also have an organization called American Legions, and they get together annually. And they got together annually in that hotel in 1976 in Philadelphia. Between July 21st and 24th, that's the time the convention was taking place. Very interesting. On July 26th, of all the attendees of the convention, 18 people were dead suddenly. Okay, it's not normal. It's not normal. So the doctors in the Philadelphia, they called the CDC. CDC is the Center of Disease Control. It controls the disease, manages the outbreak in the USA. Every country has its own CDC. Saudi Arabia also has its own CDC. Anytime there is an outbreak, these people go first. So the CDC was reported that there are severe respiratory illness among these attendees, and there is no cause. They didn't know what is going on. And by August 2nd, there were 71 additional cases. This is a classical example of epidemiology, particularly epidemiological investigator, infectious disease investigator. So CDC will send investigators. They will go to the field and run an investigation and find out the cause of the
Disease.
death.
Or
Disease
death.
and the death. We don't even know what is that disease at this point. We just know that people were experience severe respiratory illness and they are dying. Okay? So the CDC trained physicians like you will go to the field, and then they identified the hotel where all the attendees are coming. Suppose that is Hotel A. So they stratified the people by their age, 39, 40, less than 40, 42, 49, 52, 10 years interval. And they identified how many people are in each of the age group, and in each age group, how many people got sick. That's the first thing that you have to do. Epidemiology is about person, place, and time. So this is by person. Okay, and the first thing that comes to your attention is what? If you think about the number of people, the most cases were between 50 to 59. 27 people were sick. Okay? So any physician will pay attention to that age group. But the smart one will pay attention to 70 years and older, because they are going to look at the rate. They will not look at the count. If you look at the rate, where is the rate highest? 70 and higher. So they know that this disease frequency is highest among the older people. So that's the number one thing that they found out. I will come back to this example. Very interesting. Now, the doctors are there in that Philadelphia. they will have to run a study. What kind of study will do? That's how we need to know what are the different epidemiological studies are there. There are broad two types of epidemiological study. One is observational and the other one is experimental. How you remember this? Observational study, the investigator, the researcher or the doctor who is running the study only observe the people, only observe the study participants. They don't do anything. Observe and record. That's the observational study. Whenever they give something, either a drug or any other intervention to some participants and withhold it from the other person, they now run an experiment. So there are two types of study. One is observational, the other one is experimental. Observational, the investigator only observes, doesn't intervene. And in experimental, researcher intervene with a drug or an intervention or something else. Now, of the observational study, there are two types. One is descriptive, the other one is analytic. The name will tell you. You don't have to remember memorize the definition. Descriptive is
Describe.
describe. You describe the disease. Describe the disease in terms of what?
Shape.
No, I said it. Time, place, and person. Okay? In analytical study, you analyze the cause. Analyze the cause. What and how. How and why. This is very, very interesting. If you can remember the descriptive and the analytic, in the next slide, it tells you what is the difference. If there is a descriptive epidemiology, we ask who is getting the disease, where they are getting the disease, and when was that they are getting the disease. Time, place, and person. So if in the exam, I give you a scenario, and I ask you, is it an example of descriptive epi or analytical epi, you will know. If I only talk about the place or time or person, you say that this is a
Descriptive.
descriptive epidemiological study. On the other hand, if in the scenario, I talk about why and how, then you know that it is the analytical epi. When we say why, when we want to know the reason. Remember, epidemiology had 2D. One is the distribution,
Determine.
and this other one is the determinants. So distribution is descriptive epi, and determinants are
Analytic.
analytical epi, because that's when you ask the question why someone is getting sick and how are they getting sick, what is the mechanism of action. When you have that sort of question, you are dealing with analytical epi. Have I bored you? Have I made you bored? It's a little dry, it's not very interesting, but I'm trying to make it as simple as possible. Now I'm bringing the second example, and you will know what is descriptive epidemiology looks like. A very important paper came out in 1982. They were saying that one of the states, America is a very big country, it has many states. One of the states is state of Georgia. It's like Al-Qasim, a lot of farmers are there. It's an agrarian economy, but not like Al-Qasim. Al-Qasim is plain, like flat land. Georgia has flat land and also has some mountains. Okay, so they were, health department were seeing a lot of tractor related death. People were hit by a tractor, fell from a tractor, run over by a tractor. There are a lot of deaths in in Georgia by the tractor. And so the health department of the Georgia sent their investigators, epidemiological investigator, find out what is going on. So what do you think that they will do? They first will do descriptive epidemiology.
After that, analytic.
After that, they will do the analytical epidemiology.
Analytical.
So first they did this. All the death, they know exactly when that death took place, which day and at what time.
And where?
Yes. So this is a graph of hour of the day. So it's 7 a.m. in the morning all the way until 12 p.m. at night. Okay, and then they put the death. Can you tell me like where the most death, at what time the death occurred?
5 p.m.
Between 4 and 5. Between 4 p.m. and 5 p.m. And in the morning,
11 to 12 afternoon.
11 to 12. 11 a.m. to 12 is a peak, and again between 4 and 5 is the highest. So the first when you graph it, it gives you a clue. Death is not occurring first thing in the morning or in the late afternoon or in the evening, but between 4 and 5 and 11 and 12. You need to think about what is going on during this time. Okay. Then, so that is by the time. Then they looked at the fatalities by the age group. And when they looked at the age group, what they found?
60 to 69.
60 to 69 year age group, that is the age group where the most fatality
Death.
happened.
Yes.
Most death happened. Fatality means death. So that's also a risk group. And third is they looked it by place where the fatality is happening. And if you look at the map of the Georgia, where the most fatalities are happening? In the north. So you now know, as the scientist going there, that elderly people are more likely dying. The time of death, the highest is between 11 and 12, and between 4 and 5, and the most death is on the north. With these three information, you can develop a hypothesis. Well, you haven't visited Georgia, you don't know. So let me give you a little geographical information. No, south is more flat, north is more mountainous. That's number one. Okay? Number two, time of the day. 4 and 5, and in the Saudi, what is the office time? In the morning to afternoon, like at government office by 1 and 2. Over there, the office time is until 5 o'clock. So 4 and 5, during the rush hour, all the people are coming from the work. That's the fatality. But what about in the morning, 11 to 12?
Lunch break.
Lunch break. Huh?
Result.
Okay, thank you. 11 to 12, what happens at this time?
Lunch break.
Lunch break, very good. That's the lunch break. Also, that's the time school also ends. Okay? So now put all these pieces together. In the northern area where there is hilly road, elderly tractor drivers coming and hitting with the oncoming rush from the office going people, or in the morning before the lunchtime they are coming out to have their lunch and getting into an accident. Okay, so this is like a preliminary data, preliminary hypothesis, but it may not be true. You need to collect data, select a study, and test it. After testing, you may be proven wrong or you may be proven right. So that's what science is. Science is making the best guess, we call hypothesis, and then collect data and then test it. And with the testing, either we prove ourselves or disprove ourselves. That's what science is. Now, this is a little bit dry slide. A couple of information, like whenever we do epidemiological study, we need the data. Where do we get the data? We get data from 4 different sources. One is from the individual. If the people are affected, if the COVID-19, people are affected, how can we collect data? We can survey them with a questionnaire. Okay. For example, if there is a outbreak of diarrhea in
Dust.
the male dormitory,
Oh.
what we should do? We should interview all of the
Students.
students with a questionnaire. So that's the number one type of source. The second type source is from the environment. If it is a foodborne illness, we will go to your kitchen in the dormitory and we will take leftover food and we will examine it. Okay? Sometimes there are diseases due to the air pollution. We will take the sample from the air, from the water. Okay? The third type of information comes from healthcare provider. You are a physician. But you probably know there are certain type of diseases. If you find it, you must report it to the higher authority. You know that. For example, a patient comes with the rabies. Rabies means bitten by a
Dog.
rabid dog. You have to report it. You have diagnosed a patient with meningitis. You have to report it. So there are certain diseases. If you have some diabetes, you don't have to report it. But meningitis, you have to report it. There are diseases that are reportable by law in every country. So healthcare providers send those kind of data. And then there are some data that comes outside from different government agencies. Like for example, in Saudi Arabia, in USA, it's very like a lot of research on the tobacco front. So they will collect data from the cigarette sales or for example, some people are interested in the substance use. Substance use means drug use. So they collect data from the Department of Motor Vehicle and the police driving under influence. They collect the court records, how many people were convicted for the drunk driving, or how many packet of cigarettes were sold. All of this data come to the epidemiologists from different sources, and they use it to solve a health problem. Okay? Now, when you conduct a study, you have a hypothesis and you try to prove yourself or disprove yourself of that hypothesis. Any research question or a hypothesis can be broken down into two parts. One is the cause, the other one is the effect. The cause, we call it exposure, and effect, we call it outcome. Okay, for example, people who eat salt more likely to develop hypertension. What is the cause here? Salt. What is the effect?
Hypertension.
Hypertension. It says that when there are a lot of clouds in the sky, it rains. So what is the cause here? Cloud. And outcome is the
Rain.
rain. So any sentence can be, research question can be broken down into two pieces, cause and the effect. And with the research study, we try to see that, establish that relationship. Okay? And we have two different types of study, experimental study or observational study. We can only observe. On the observational front, we have two types, either describe or analyze. Okay? Today, we will look at only observational study. Okay? Epidemiologists don't do a lot of experimental study. Now, of the observational study, first one is the cross-sectional. We will talk about cross-sectional study in its own class. But suffice to know, cross-sectional means at a point of time, you take a group of people,
Sample.
a sample, and then assess the exposure and the outcome at the same time. So cross-sectional study where exposure and outcome, cause and effect were assessed at the same time. Okay, so that's a cross-sectional study at a cross-section of time. Okay, so you are interested to know, you probably think that those who are physically inactive, they're more likely develop diabetes. What you can do on January 2023 or say September 2023, go to the book area, take a sample, a group of people, give everybody a blood test to see whether they have diabetes or not, and interview them about their activity. And based on that activity, categorize them as active versus non-active. And then see whether the diabetes prevalence is higher in the inactive group. If it is, then you know that there is an association between physical inactivity and the diabetes. So this would be a cross-sectional study. Why is cross-sectional? Because exposure in this case is physical inactivity and outcome is the diabetes. Both information were collected at the same time. That's why it is cross-sectional. Malum? All right. The second design of the observational is cohort study. Cohort study, another name is longitudinal study or follow-up study. It is not cross-sectional, not at a cross-section of time, but you take a sample and then you follow them up for a long period of time to see who develops the disease. Okay, so that's a cohort study. And cohort usually at the baseline, they are divided according to the exposure. So for example, you are interested to know what is the relationship between smoking and lung cancer. You take a big sample from the book area and ask them about their smoking and group them into non-smoker A, B is the past smoker, they used to smoke, now they have quit, and C is the current smoker. And then follow them up for 10 years to see who developed the lung cancer. And if you find that the lung cancer rate is highest among the current smoker, then you know that there is a relationship between smoking and lung
Cancer.
cancer.
Lung cancer.
But the study will be follow-up or cohort study because you followed them. Okay?
Long time or long period.
Yes. The third observational study is case control study. As the name implies, there will be cases and there will be control. What is the cases? Cases is whatever disease you are interested in. Group of people who have the disease. If you are interested to do a case control study on diabetes, your cases will be all the people who have diabetes. And who will be the control? All the people who don't have diabetes. control. If you want to do a case control study on stroke, who will be your cases? Stroke people. And control will be those who have not suffered stroke. So case and control. Cases have the disease, control don't have the disease. These are the three main types of observational study. In successive classes in blocks, you will learn more about the details of this design. Now, think about COVID-19. Think about the COVID-19. This is an outbreak, epidemic, isn't it? COVID-19 was an epidemic.
Yes.
To the extent it was a pandemic. Epidemic, but when it spread all around the world, we called it
Pandemic.
pandemic, COVID-19.
More than one region.
So, yes. So, how do you think that the epidemiologists dealt with this disease? The epidemiologists, medicine expert, they all got together, infectious disease epidemiologists, and they went through this step. And we will quickly go through this step. What is the time? Okay, I'm good. Number one, you have to establish that there is an outbreak or there is an epidemic. If you cannot establish that this is an epidemic, it stops right here. How can you establish epidemic?
Expected versus.
MashaAllah, very good. One person paying attention. You have expected level of the disease, and if you find that currently the disease rate is way higher than the expected, you call it an epidemic. So in order to know that, you will need the data. First you collect the data, and then you count the diseases, the disease that you are interested in. You calculate the rate, and then you compare with the historical data. And if you find that the current rate is higher than the historical rate, you call it
Epidemiology.
Okay. We'll go one by one this step. Establishing the existence of an outbreak. How do you do that? You collect data from the data sources, calculate the disease occurrence rate, and then compare with the historic rate of that disease. And if you find the current rate is higher than the historic rate, you call it a outbreak.
Outbreak.
Next, preparing for the field work. Remember, the outbreak investigator, they do not work in the computer only. They have to go to the field, exactly where the disease is happening. So in order to go there, you prepare yourself. You research about the disease, study a lot, gather all of your supplies and equipment. Maybe you will have to take samples, you have to do some testing, take all of your equipment, and then make a travel plan. You will go to the place where the disease has started. You have to assemble a team, and that team has epidemiologists, medicine specialists, laboratory technician, demographer, different type of people go there. So, suppose that there is an outbreak happening in Bukhara, and from Riyadh, the Ministry of Health sent their team. So, they first identified, called it an epidemic, and then they arranged a travel to Al-Qasim, brought all of the equipment and researched the disease. Number 3, verifying the diagnosis. We are calling it COVID-19, but we have to make sure that the people who are, we are saying that diagnosed with the COVID-19 is actually suffering from COVID-19.
Yes.
How do you know that?
By taking some tests.
Diagnosis.
Right. You speak with the patient, look at their sign and symptom, and more importantly, look at the laboratory test. Laboratory test will tell you that they have COVID-19.
Or not.
Okay? So number 3 is very, very important. you have to verify the diagnosis. Number 4, define the cases. Define the cases and identifying the cases. Will you consider, like seen in this outbreak, will you consider any person with the COVID-19?
No.
Maybe, or maybe you are only interested with those COVID-19 patients who have severe respiratory illness. Whatever it is, you have to define it, because case definition is very, 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 very important. So number 4, you have to define the case. Okay? And once you define the case, all other cases have to meet up that definition in order to be included into your study as cases. Once you have the cases, then you do the descriptive epidemiology. What descriptive epidemiology you do?
Where?
Where, when, and who. Time, place, and person. The first thing you do. All right. Remember that thing I was talking about? The 1976, the military guy, retired military guys were coming to a hotel in Philadelphia, and suddenly they were dying in the acute respiratory illness. I'm bringing that example back. So, what kind of descriptive epidemiology this is?
I think this is descriptive.
Descriptive. Descriptive has 3: time, place, person.
Yes.
This is a graph of which one? Time. Very good, very good. They have the x-axis is the time, July and the August, all the way from the 1st July to the 16th of August, and they have lined up all the cases. When the cases is the highest?
In 25 of July.
July 20,
25,
24 to 25, 26, 27. Like 24 to 27. That's when
Yes.
the highest cases.
Yes.
Okay?
Mhm.
So, investigator is thinking something is going on during that time, because there are not many cases before, and then cases are going down afterwards.
Hmm.
That's when the highest, something happening during that time between July 24 and July 27. So they looked at the time. What should they look?
The
now?
place.
Very good, place. They looked at the
People.
place. Okay, people and the place. In Philadelphia, those people who came to the convention did not only stay in one hotel. They identified that they were living in 3 hotels. Hotel A, Hotel B, and the Hotel C.
I think Hotel A is the percentage is more high than Hotel B and C.
Very good. So in this, you have the data on the place and also by the person. And as one of the boys identified it correctly, something is going on the Hotel A. What do you think? In the old age group, the Hotel A has the 20% sick. In the Hotel B, only 6%, and Hotel C, 12%.
Hmm.
So there is something going on in Hotel A.
Hey.
So they identified, they
The time.
understood a couple of things. Between July 24 and 27, there is something going on
Hotel
in
A.
the Hotel A in this age group of people.
Hmm.
What is that?
This is descriptive.
This is descriptive. Okay. will come.
Now, why and how is analysis?
Right. Now they will go for the
Hypothesis.
hypothesis. Very good. Why? Develop a hypothesis. Why this disease? And how is this disease happened? You develop a hypothesis. That's number 6.
Yes.
Step number 7 is you evaluate it for its validity, whether it's correct with the data analysis, and if it needs to be, you refine the hypothesis.
Alternative.
So this, until you are confident about your hypothesis. So it is permissible. It's trial and error. You go through, you develop a hypothesis, you check, and then you refine your hypothesis.
Can
if
be
possible.
recheck.
Right. And number 9 and 10, I will talk about it. What was the number 9 and 10? One is that you have to, once you find out what is the cause of the disease, then you have to find out what is
The solution.
solution. That's number 1, the solution, and the number 10 is
Feedback.
not feedback. You have to communicate with the people.
To see that if the solution is correct or not.
No, it's not that. It's called dissemination of the result. Say, for example, something bad happened in your dormitory. I went there as a researcher. I did my study, and I found something that is, there is a problem in your kitchen. I identified it. I sealed it. Okay? Or fixed it. Don't I have the obligation to call all of you or to let you know what I have found? So last is communication. I have to communicate with the students, with the university administration, and also health department in the Al-Qasim that these are my findings. Because with that findings, you will benefit. The next time you can be careful. The administration can take an appropriate measure. The Al-Qasim Health Department can also allocate resources and the policies. Okay?
And
Maybe they
improve.
will- yes. Without communication, if I held all that information to myself, there would be no benefit,
No improve.
no improvement. So the number 10 is communicating the findings. So,
I think the
what happened in 1976, it had created a lot of papers. In the beginning, the success didn't come. 5 months after the investigation and reinvestigation, they found out that spending time in the lobby of the Hotel A was a risk factor for illness. Spending time in the lobby of Hotel A was the risk factor.
why?
Right. So then laboratory technician took the sample from the Hotel A in that lobby area, and they found out the organism, that Legionella organism, this bacteria, was in the air condition. And those old people that sitting in the lobby and that summer hot, and all their AC, through the droplet, all the bacteria went to them and they got sick. So think about it. Someone from the CDC went there and pinpointed exactly what is the disease, what is the cause of the disease, and how the disease happened. So this is how. The old people were sitting in the lobby, and in the AC, the droplet coming, and they were getting the illness. So that's how the outbreak investigations are done. they located the bacteria called the Legionella bacteria, and that's why this called Legionnaire's disease. The Legionella and Legionnaire's is not the same thing. Legionnaire's disease means Legion means army column, because they were army and the retired people, so that's why they call it Legionnaire's disease. And the name of the bacteria is the Legionella bacteria. So, we already talked about the step 9 and 10. You communicate the findings, determine who needs to know, how information will be communicated, and why the information needs to be communicated. And with that, you close the investigation.
Step number 9 is the solution, yes, doctor?
Right.
Step number 10, the communication. with the
Communication.
patient. Okay.
So that is in short a very fast
Summarize.
summarization of the intro to epidemiology, like the start of this field today. Now, what time is it? 12. The azan will not come another 5 minutes, so I can take some questions first from the females. Let me inquire from them. Were you there? Are you there? Did you listen to the lectures, and do you have any questions?
Yes, Doctor, we listened to the lecture and also we don't have any question.
That's a bad sign. When you don't have question, meaning that you didn't even pay attention. Because
No, Doctor, it's not clear. Because that we understand.
Okay, all right. So smart girls are there. I see a lot of hands raised in the boys' side. So am I to conclude? Yes.
So if the determinant was in Hotel A, how was it in Hotel B and C also? Was it because people traveled or was it because of the AC problem?
MashaAllah, very good question. Yes, because it's an infectious disease and it spread through droplets. What happens is they're all friends. Somebody who is staying at Hotel C came to spend time in the Hotel A lobby, and the Hotel A people are going to the Hotel B and C. So it's through the communication. Okay?
So another question.
Yes.
At the beginning of the slide, you said STD patients are at high risk. Are they always at high risk for every disease, or is it just certain diseases? The IV drug users for STDs, are they always at high risk for diseases, or is it just?
Yes. Needle sharing. IV drug users, particularly, I don't think that you have this problem in Saudi Arabia, but the area that I come from the subcontinent, right after my graduation, I worked in one of these projects. Okay, and later on the USA, I saw the same things. What happened is, those who are IV drug users, okay, they share needle because sometimes they are poor, a lot of them are poor, they cannot afford good drugs, meaning purified version like the cocaine. So they get very impure form, and then they also share the needle. Somebody takes the disease, push the drugs, and then they give the needles to his buddy, and then he takes the drug. So IV drug users not only in higher risk of STD, they are also have higher risk of hepatitis B. Okay, they are also hepatitis B and C, very high risk. Yes. For example, truck drivers are high risk for STD. Why? Particularly long distance truck driver. You don't have this again here in this country, but if you go in the USA or in Bangladesh or in India, Nepal or Thailand, you will find that when the truck drivers are going because they are away from their family for weeks and months, they will go into the brothel. Do you know what brothel is? Brothel is where the sex worker stay. Okay, we call them sex worker. There is other name is prostitute.
Mhm.
So they go to them, and so these truck drivers and sex workers, they are also high risk for STD. Okay. Who is the high risk? Okay, go ahead.
No, in the beginning of the lecture, doctor, you said that epidemiology is like complementary with our clinical
Medicine.
yes, or medicine, yes.
Medicine, yes.
So I think that because epidemiology describes or specifies
And the girls needs to hear your.
the disease. Because epidemiology describes the disease and medicine solve it with drugs or maybe some
Right.
surgery. So I think that that's what you mean about the epidemiology is complementary with medicine.
Complementary medicine, every new disease that you first know or comes into the population, the epidemiologist will go and try to find out the distribution in terms of place, person, and time. And then they will find out what are the causes of the disease. And then they will also develop intervention. Usually the classical epidemiologists don't do intervention. Usually medicine people do the intervention. But these days, epidemiology is widespread. I just said epidemiology, but now epidemiology has a lot of branches. Genetic epidemiologist, environmental epidemiologist, hospital, clinical epidemiologist. So epidemiology, laboratory science. Okay. So
Okay.
lot of like area. Go to the mother and child care epidemiology. Okay.
Thank you, doctor.
All right. Any other question? So, if you permit me, then we will end the class. Listen, for your mock exam, review
Lecture.
the lectures.
Can you upload it in the e-learning?
Yes, I'll do that. And I will not ask you a question that I have not discussed in the class.
Okay.
So if you have come to the class and paid attention, inshallah you will do that.
Thank you, doctor. Thank you so much.